The broadcast is now starting. All attendees are in listen-only mode.
Good morning and welcome to the Vascular Tissue Challenge informational webinar. My name is Josh Newbert. I'm the managing partner for the New Organ Alliance running the Vascular Tissue Challenge. We're going to run through a series of informational slides and updates about the challenge for all potential teams, researchers that are interested in just learning more, or other interested parties that want to learn more about the challenge. So we're going to go through a series of slides, and we have a few different presenters from the partners on the program who are going to give you some information. And you'll notice if you're logged into the webinar that there should be a chat box in your control panel. So as we go along with the information for this webinar, if you have any questions that you'd like to bring up, please go ahead and post them in that chat box. And we'll try to address the questions as we go along, and then we'll have some additional time at the end of the webinar to address any that we haven't come together with. So again, welcome, and we'll start moving forward on our information. So you can see that this challenge is operated by the Methuselah Foundation's New Organ Alliance. We have partnered with CASIS, which is the Center for the Advancement of Science in Space, to do an additional award on top of the Vascular Tissue Challenge. And the challenge itself is supported by NASA's Centennial Challenges program. So you'll hear all about these different partners as we go along. For this webinar, we're going to go through an agenda where we have introductions of the different partners involved in this program. Then we're going to get into an overview of the challenge and some of the science behind why this challenge exists. And then we're going to talk more specifically about the rules and the details in what the teams will have to do in order to win this challenge, as well as the separate CASIS Innovations in Space Award. And finally, we'll talk a little bit about some of the next steps for those of you that want to be involved in the challenge and actually submitting as a team. So we'll end with that and some questions that you might want to bring up. So the first thing to mention, we want to make sure everybody understands what the NASA Centennial Challenges is. So I'm going to turn the mic over to Monse Roman, who is the director of NASA's Centennial Challenges program. So give us 1 second while we transfer over. And Monse, you should be good to go.
Good morning to everybody, or good afternoon, depending where you are. So thank you for joining us today. We just wanted to give you a small understanding of what Centennial Challenges is at NASA and why are we partnering with Methuselah Foundation and New Organ to get this done. Centennial Challenges basically is the way that NASA has to reach out to the communities, to the nation, asking the community to come and help us solve problems that we have on our journey to Mars. And what you see on your screen right now is pieces of the puzzle. So each of our challenges represent a piece of the puzzle that we as a community could help solve using open innovation, crowdsourcing, or the kind of things we're doing for this challenge. The one on Vascular Tissue Challenge you're going to see closer to International Space Station on Earth. We're hoping that this challenge help us with initially with understanding the effects of radiation and other negative conditions in space on tissue, that and eventually translate that to what it can happen in humans, and more importantly, see how we can mitigate those effects. So maybe having ways of making that less, affecting the humans less by testing the tissues. And of course, in the course of doing this, we're also interested in the possibility of having commercial interest from outside, from any of you, with the potential of maybe in the future having I don't know, the vision of many, many years from now, having perhaps a way of making organs, growing organs in space that could be brought back to the ground to help the many needs that we have on the ground for organs. So that would be, again, a very, very big and very ambitious goal for the future. In addition to that, we have many other challenges that are either open or have just closed. We have one that just closed about this weekend. So I welcome you to also look in there, and those challenges are very, we keep changing them all the time, so please look often, and if there's a question, please feel free to contact me or contact Josh, and Josh will know how to contact me. Again, I just want to make sure that you understand that we're trying to solve the hard problems with the help of the community, to help the nation. Within NASA, we have incredible scientists and engineers that are working a lot of these issues, but we would like to see how other people might help us, might solve these, and with the intention of potentially in the future incorporating some of your inputs into what we do. So I think I have one more chart. Which is the next chart just have our website, and so it's www.nasa.gov, win it, and I really am very excited to be collaborating with Josh in this endeavor, and I am looking forward to one of you listening today coming with an incredible solution to growing organs in space in the future. So we think it will have an enormous amount of commercial potential, and it will be an incredible thing for us to accomplish as a team. So anyway, with that, I pass the baton back to Josh.
Great, thanks, Monse. So that was a great overview of NASA Centennial Challenges, and we're really pleased to be able to work with the NASA program on this. I think it shows a good public-private partnership. I want to introduce a little bit of the New Organ Alliance to everybody here. I'm going to speak really quickly about New Organ, and then turn the mic over to David Goebel, who is the CEO of the Methuselah Foundation. The New Organ Alliance is an initiative of the Methuselah Foundation to focus on using prizes and incentivized innovation to help advance tissue engineering, regenerative medicine, anything that can help bring about the day where we actually have tissues and organs in the hands of the patients that need them. So New Organ as a program is really focused on that end goal of actually getting these solutions to the patients. The way that we operate is that New Organ hosts challenges and other prizes and opportunities to help incentivize new advancements. The best way to do these prizes is when they're paired up with different grants and research opportunities. So we try to help researchers see how they can use the traditional grants from government or other philanthropic foundations to help advance the work that they would do to get towards one of these prizes or milestones that we put out there. Outside of the Vascular Tissue Challenge, the New Organ also has a liver prize that was announced a couple of years ago. So if any teams listening in are interested in the liver prize, please contact us after the webinar, and we can get you more information about this. But it's another prize for tissue engineering specifically on a liver. So with that, I'm going to turn it over to David Goebel, who will give you more of the background on the Methuselah Foundation, why it launched the New Organ Initiative, and what it hopes to achieve. So, David?
Thanks, Josh and Monse. So the Methuselah Foundation is trying to make 90 the new 50 by 2030. We're a very engineering, numerically oriented organization for the sake of human beings' aspirations and happiness. That sounds like mom and apple pie, and I like apple pie, and I like my mom. So how do you get there? So we have some very simple strategies, easy to understand. Our strategy in partnership with NASA is essentially new parts for people. You can get a new transmission for a 1961 Corvair, but you can't get a new heart unless somebody else dies, and then it doesn't fit, and it's a junkyard part. That has to change. Other strategies, getting the crud out of our bodies. By the time we're 65 or so, somewhere between 5 and 15% of us is landfill gunk. It needs to get out, and so forth. So, in general, we wanted to partner with NASA because on the way to Mars, there's no hospital, there's no CVS drugstore. You have to make it the whole way and back with these human beings who are constantly being insulted by who knows what on the way. So in order to have a full complement of medicine, you need to take a completely different approach. And so you could say that the vascular challenge, or what I think of also as a microvascular challenge, will help us get to create profoundly sized three-dimensional tissues so that you can create things like skin patches, organ patches, and as Monsi pointed out, test tissues that don't require human beings to be harmed in order to find out what happens when you're in a long-term space mission. We were the first investor in a company called Organovo. During the market crash of 2009, we invested on the day that the market bottomed. Not because we were smart, it's because it was our mission to make this happen. So yesterday, Organovo announced the first 3D human kidney tissue assays for toxicology and metabolic studies. That is an incredible breakthrough because there has never been such tissues available for research of any kind. It's all about mice these days and in vitro. However, they can only be about 20 cells deep, which is great for toxicology, but not good for tissue patches and eventual organs. The rate limiter is microvascularization. So it is our hope, in fact, expectation that one of the winners of this incredible prize will solve that problem and make it possible to go from 20 cells thick to arbitrarily sized tissue masses up to and including heart, lung, kidney, pancreas, and new skin, all on the path to making 90 the new 50 by 2030. Thank you.
Great, thank you, Dave. So hopefully that gives everybody a decent background on some of the players in the vascular tissue challenge. The program is also supported by a group of wonderful judges that we want to make sure we introduce you to on this call. We have a number of the judges on board with us. So I'm going to run through just who we are, and if you're on board, please say a little bit about why you're here for us all. So we have Dr. Bishal Adhikari from the NIH, and Bishal, I believe you're with us. Do you want to say a few words?
Sure. Hi, I'm Bishal Adhikari. I'm at the NIH in the Heart, Lung, and Blood Institute. I work as a program director overseeing basic and translational research grants in the areas of arrhythmias and heart failure. And I'm keenly interested in this challenge because in terms of heart disease and heart failure, as was mentioned, tissue patches is a viable, unique and novel, would be a novel intervention. We have done a lot of research in the fundamental areas, but in terms of clinical applications and translational approaches, this should be a very, very interesting solution. Thanks.
Great, thank you, Bishal. We also have Dr. Chris Brewer from Nationwide Children's Hospital. Chris can't join us today. And then we have Dr. Wendy Dean, who is a medical officer at the USA MRMC. So I believe Wendy is with us here. Wendy, do you want to say a few words of introduction?
Sure, thank you. So I have been the medical officer for a tissue injury and regenerative medicine program management office at the Army's Medical Research and Material Command for the past 6 years. And the reason that we're interested in this particular challenge is because this will help our soldiers and our veterans to recover more fully. It's best if you can restore like with like, and if we can overcome this vascular challenge or this microvascular challenge, it will open up a whole array of tissues that we can hopefully use to restore our wounded warriors to form, function, and appearance more fully.
Okay, thank you, Wendy. As continuing on with our judging committee, Dr. Timothy Hammond is a professor of medicine at Duke University. Tim can't join us today, so I believe we do have Dr. Albert Lee with us, who is also with the NIH. So let's see, Albert, do you want to say a word of introduction, a couple words of introduction?
Sure. So I also work in the same place as Bisho Adhikari does. I help oversee our tissue engineering and regenerative medicine portfolio. And I'll just say briefly that here at the NHLBI, I mean, we fund a lot of work in this area, but so far it's only, we've seen sort of small chunks of tissue or small vascular units. And I think I'm interested in this challenge because I'd like to really see this field go forward. I'm hoping this competition can really stimulate development of large blocks of tissue that are vascularized. I think that would be a huge move forward for the field. So I'm very excited about this challenge. Thanks for the opportunity.
Great, thank you, Albert. We also have Dr. Armand Keating on the call with us. Armand is the director of the cell therapy program at the University of Toronto. Armand, do you want to introduce yourself?
And of biomedical engineering at the University of Toronto, and I founded the cell therapy program at University Health Network, which comprises 4 hospitals and institutions with a focus in particular on regenerative medicine. And I really want to compliment the Methuselah Foundation for its initiative in moving this forward. I think this is going to be a very important step, and I anticipate that there'll be some very exciting results that will arise. So thank you for the opportunity to participate in it.
Great, thank you, Armand. Next on the judging committee, we have Dr. Michael Roberts, who is the Deputy Chief Scientist for the Center for the Advancement of Science and Space. So Mike, do you want to introduce yourself? Mike, it looks like you're still muted. You might need to enter your audio pin on your phone, Mike, is what it's telling me. Okay, well, we'll come back to Mike. Mike, there should be a pin that you enter on your phone to allow your phone access to the voice of the webinar. So we'll hopefully be able to get you back on in a few minutes here. The last judge for our judging committee, who is also with us today, I believe, is Dr. Alan Russell. Alan, do you want to go ahead and introduce yourself?
Yes, I'm delighted to join this distinguished team and have been involved in tissue engineering for a number of years, was very involved in the formation of the Tissue Engineering and Regenerative Medicine International Society, and a number of other major initiatives in the field. And I think one of the most exciting aspects of this particular prize is the degree to which it's really focused on delivering organs that can actually function and work. So very, very excited to be participating.
Great, thank you, Alan. So as we go forward in the Vascular Tissue Challenge, we'll be interacting with this distinguished judging committee to make sure that any questions on the rules or regulations of the challenge are addressed in a proper and timely manner. And the judging committee will also be the ones who are going through the review process for any teams that get into the submission of solutions to this challenge. We'll keep everybody appraised as the challenge moves forward with this. But I want to make sure that you know, that this is a very exciting and distinguished judging committee that we have involved in the challenge here. The next group that we wanted to introduce was CASIS. CASIS is supporting an Innovations in Space Award that is tied to this challenge. And I'm going to turn it over to Jana Studemeyer, from CASIS, to give everybody an introduction about their organization. So, Jana?
Great. Thanks, Josh. I really appreciate the opportunity to speak with the group this morning and to be part of the challenge. Just as background for the group, so Center for the Advancement of Science in Space, CASIS, manages the International Space Station U.S. National Laboratory. We were appointed by Congress in 2011 to provide access to the unique capabilities of the lab on station to researchers and commercial companies, really to benefit and improve life on Earth. And, I've heard all the comments from the other presenters so far about solving the organ shortage and the challenges that we face here on the ground. We certainly support that as well. We work across many different sectors, physical and life sciences, as well as remote Earth observation and sensing capabilities from station, but we have a significant focus on organ bioengineering. And, we view that process as a stepwise process. Stem cells, microphysiological systems, or organ-on chips, as you've been hearing about, as well as tissues, organs. And on that road, the path that leads us to being able to generate whole organs for benefit to those that are on transplant lists and waiting here on Earth, we see that the tool of the platform in microgravity that can really accelerate research could have some substantial impact. So Mike is going to talk a little bit more, hopefully when he's back on the line. It looks like he's back on now. Later in the presentation, he's going to give you a little bit more background about the benefits of research in microgravity and how we feel that that can help to contribute to the field. So we're very excited to be a part of this. Obviously, the groundwork that's done that potentially will lead to a flight experiment that will accelerate this work even further is something that we're very pleased to be a part of.
Wonderful. Thank you, Jana. So with that, we're going to turn over to starting to talk a little bit more about the details of the Vascular Tissue Challenge. One thing about this challenge is really understanding why are we doing this, and this is something that the New Organ Alliance is going to be very specifically focused on as we continue to provide more prizes, more challenges, more opportunities to help you advance your research in this field. I think this one chart that you're seeing now really sums up the why we're involved in this. That the wait list for new organs continues to grow while the donors and transplant has really stagnated. So what we're trying to do with this challenge is to take the next milestone towards opening up the opportunities to provide new organs and tissues to the patients that need them. The New Organ Alliance is working with a number of partners to help roadmap the next steps along the way to get there, and we'll talk a little bit about an upcoming workshop that we have where we focus on the Vascular Tissue Challenge and road mapping the future milestones that will come out of this. But this chart really sums up why we're involved in everything that we're doing here. And to get into the actual vascular tissue challenge, we wanted to show you a quick video that NASA put together about really highlighting why they're involved in doing tissue engineering. Because I think for a lot of people, NASA wouldn't be the first place that you go to when you say, hey, I want to see what's going on in tissue engineering. But this quick video really gives some high-level overview of why NASA is involved. So let me see if I can switch us over to that. Okay, so hopefully that gave everybody just a quick introduction to some of the more high-level reasons why NASA is involved in this. We will now talk a little bit more about the specifics of the challenge. So some of the high-level information. So for this, I'm going to hand it over, to one of our judges, to give us a little bit of the information of what this challenge is all about. So I believe, Armand, do you want to take it away?
Thank you very much indeed, Josh. Well, that was an excellent segue to tell you about the requirements for this challenge. And overall, it's a $500,000 purse that's going to be provided by NASA that will be divided among 3 teams to successfully create a thick human vascularized organ tissue in an in vitro environment that will maintain metabolic functionality that's similar to what goes on in native cells over a 30-day survival period. And CASIS has also partnered with the New Organ Alliance to provide an additional award, which you're going to hear about a little bit later on, to further one of the 3 winning teams' research on vascularization, particularly as it pertains to microgravity. And right, so the specific requirements are that it should be a 1 centimeter thick human tissue. And I think Dave very nicely itemized the tissues that are candidates, and that this tissue needs to be actively perfused, and the perfusate can be anything that in fact will lead to functional parenchymal cells that are vascularized or microvascularized, and that would need to be done over a 30-day period. And this needs to be done 3 times. It doesn't have to be done on the same tissue, but it can certainly be done on the same tissue, and a total of $500,000, as I said, would be made available from NASA. Next slide. And the first prize award is for $300,000, and then $100,000 each for the first and second runner-up. And I think that covers what I was going to talk about, Josh.
Wonderful, Armand. Thanks for the introduction to the challenge there. we also want to talk a little bit about some of the potential technologies and advancements that we hope this challenge can lead to. So for this, I'm going to turn it over to Alan Russell, who will give us a little bit of the information from the scientist side of, well, yeah, why are we really doing this this challenge?
So thank you, Josh. I think the first thing to stress again is the important role that NASA has played since the beginning of the birth of tissue engineering, when they really were a major leader in the field right at the very outset. But obviously the field has evolved a great deal and is left with some core challenges, particularly in vascular tissue engineering. Solving those challenges, the most obvious thing, the most easy to explain one, is obviously the availability of tissues and organs that can be transplanted, and in many ways that's been the thought process behind tissue engineering from the earliest days of 20 or 30 years ago. In addition to that, there are sort of not just dual use, but you could almost think of it as quadruple use technologies. If one was to be able to create natural tissue in a dish, then obviously one would be able to do things like testing drugs and drug models and creating a whole variety of experimental systems that use living tissues but outside the body, without having to sacrifice animals or do advanced experiments on humans or primates, etc. So very exciting is the opportunity to create lifelike living tissues that are then used for drug testing. That can include all sorts of different tissue-based assays. An example of the marvelous advances that took place as things like a human immune system were created in dishes and in robotic systems to allow testing and assay development using those, so standardized assays. And then finally, and really interestingly, there are experiments that one can't do with living systems that one could do with a living engineered organ or engineered tissue ex vivo. So modeling of disease is a key one of those. There are probably many other things, but these four things together really represent a major driving force behind why we're so excited to take a look at the ingenious solutions that people come up with to the challenge that we're laying out today. Back to you, Josh.
Wonderful. Thank you, Alan. So we hope that everybody's really excited about the opportunity with this challenge, and there's lots that we can envision coming out of the research that you guys are already involved in, and that hopefully is incentivized through this model. The next part of our presentation is that we want to talk a little bit about the science of microgravity and how this impacts tissue engineering based on what we know so far. And for this, there's nobody better than CASIS to tell you a little bit about what's been going on with microgravity research and tissue engineering, and to help you kind of draw the connection between what you might already be doing and this challenge and the opportunities with microgravity. So for this, I'm going to turn it over to Michael Roberts, and I know, Michael, we didn't have a chance to actually get you introduced when we were looking at the judging panel there, so maybe you can give us a few introduction remarks and then go into your slides here.
Yeah, thanks, Josh. Hopefully you can hear me now. This is Mike Roberts. I'm the Deputy Chief Scientist for CASIS. CASIS, as you've heard, is the Center for the Advancement of Science in Space. And just to provide a little bit of background about how we work with NASA, CASIS's mission is to manage the International Space Station National Lab. We do that through a cooperative agreement with NASA. So like the Methuselah Foundation, we have a partnership with NASA, and our focus is on enabling access to the ISS National Lab for research and technology development. As you heard from Monty Roman earlier in the presentation, and in the very excellent introduction to my comments by Alan Russell, there's a lot of possibilities utilizing microgravity and exposure to the space environment to address issues that are relevant both to NASA's mission to go beyond low Earth orbit and explore space, as well as areas of research and technology development that have direct application here on Earth. And CASIS is focused on that part of the portfolio where we enable access to space for research that has benefit here on Earth. This obviously complements NASA's mission and the journey to Mars in that some of the things that we need to understand, some of the technology gaps, some of the risks to crew health and performance as we go to Mars mimic diseases that have impact here on Earth. So in addition to studies of effects of microgravity on musculoskeletal health, on cardiac health, there are important discoveries that can support organ bioengineering challenges that are prevalent here on Earth. And that's why we have interest and have partnered with the Methuselah Foundation to enable access to the ISS National Lab for labs who are successful in demonstrating the ability to vascularize thick tissue as part of this challenge. Josh, if you can go to the next slide, thank you. So I have 6 slides just to quickly provide an introduction and explain the distinction between CASIS and NASA. So as I mentioned, we work closely with NASA through a cooperative agreement, but we are a 501c3 not-for-profit company. And our mission, as I mentioned, is to manage the ISS National Lab. The ISS National Lab is part of the International Space Station that is provided exclusively for research or technology development that has benefit here on Earth. It's not limited to life sciences research. There are also opportunities for enabling technology development focused on microfluidic systems in the physical sciences for technology development, for educational opportunities, and there are also access to platforms outside of the International Space Station for exploring materials, physical science, or substance development where they may require exposure to the harshness of space. Josh, next slide, please. So our interest in exploring access to the International Space Station National Lab actually has been realized before in partnerships that existed between NASA and several institutes at the National Institute of Health. So previously there has been programs that sponsored research where NIH provided funding to investigators to utilize either the shuttle or the International Space Station for exploration of microgravity health effects upon areas of importance to the NIH portfolio. You'll see a few of those listed on this slide here. More recently, CASIS has stepped in to help formulate these relationships with NIH to grow them into other opportunities for sponsored research in the space environment. So we recently sponsored research investigations in the area of stem cell properties. These were investigations that were funded both for ground-based research and flight research that were focused on different aspects of proliferation or expansion of induced pluripotent stem cells in the microgravity environment, and better understanding what was required in order to utilize the beneficial effects of exposure to microgravity on the ability of stem cells to grow and proliferate. And those we see listed on the left under stem cell biology are a series of investigations. In one case, an experiment, heart cells that recently flew and was returned to Earth, and several other experiments listed there that will fly in the next 1 to 2 years. Next, under microphysiological systems, CASIS has sponsored 2 investigations recently that will be utilizing the International Space Station National Lab as a platform to investigate tissue-on-chip platforms, or in the language of NIH, microphysiological systems, and their benefit for use in the microgravity environment. One of these investigations is focused on the use of a muscle model. The other is focused on the use of a bone model. And we're currently working with the National Center for Advancing Translational Sciences at NIH to develop new opportunities with NIH sponsorship for other CHIPS in space programs. So please stay tuned to NCATS and NIH for more information about those in the coming months. And last, as part of our participation in this challenge, we are looking to actually build upon the previous research that's focused on individual stem cell growth and proliferation in that environment, the development of enabling technologies and platforms for hosting those cells so that they can actually form higher levels of organization, whether that be organoids or tissues and even organs, to begin to translate those into future possibilities of actually growing whole organs in the microgravity environment. I just wanted to show a few examples of previous NIH-sponsored research that has flown to the ISS National Lab and that demonstrates some of the capabilities of investigations that are possible in that microgravity environment. The first is an experiment that was sponsored by the National Institute of Aging with Millie Hughes-Fulford, who is exploring the effects of immune dysregulation in the microgravity environment. So in this case, Dr. Hughes-Fulford utilized the microgravity environment and its impact upon immune function. It's been observed that among crew as well as in animal models, the human immune system does not function with the same efficiency it does here on Earth. And in some cases, those effects mimic what we see in the normal process of aging and the loss of our immune system to function at its normal level. Millie Hughes-Fulford has flown several experiments on shuttle into ISS National Lab, and her lab is now focused on the role of microRNAs and their downregulation in the microgravity environment and how that may identify new targets for immune boosting in aging models, both in humans and in mice. Another investigation that flew to the International Space Station National Lab last year focused on osteocyte responses to inloading, and this was focused, a mission that was sponsored by NIAMS, the National Institute of Arthritis and Musculoskeletal Skin Diseases. As many of you, I'm sure, are aware, one of the things that happens to the human body in microgravity is an extreme unloading of bones and muscles, and that leads to sarcopenia and osteoporosis-like conditions in that environment. So the use of cell-based and animal models in microgravity is an important tool in that the accelerated loss of bone mineral density or muscle weakening enables investigators to explore pathways that are involved in those events that mimic musculoskeletal effects here on Earth and disease, and also for pharmaceutical companies to explore the efficacy of therapeutics designed to combat those in that environment. Another investigation that is currently in orbit on board the International Space Station, but the experiment has yet to be conducted, is focusing on the effect of microgravity upon gene expression and metabolic pathways in osteoblasts. So again, this is an experiment that's focused on musculoskeletal pathways in the environment. And the investigator in this case, Dr. Bruce Hammer at the University of Minnesota, is also developing in parallel with this investigation on orbit the ability to utilize a magnetic system that can mimic some of the effects of microgravity and unloading here on Earth. So Dr. Hammer will be developing and improving upon our ability to replicate some of the effects that are seen in microgravity so that they can actually be deployed in laboratories on the ground. The last example I wanted to highlight was a recent experiment that just returned to Earth. This was a focus experiment led by Dr. Joseph Wu at Stanford University that was focused on the proliferation of stem cell-derived heart cells in the microgravity environment. And what you can hopefully see in the slide on the right are actual contractile activity in the International Space Station. So Dr. Wu's lab has funding from NIH and from CERM and from a variety of other organizations. And his lab is focused on the ability to differentiate stem cells to be for regenerative medicine, to actually be able to affect heart repair. This and several other experiments are taking advantage of access to microgravity on the International Space Station to explore their ability to use for therapeutic use that are more effective than those that are grown here on Earth. And with that, I'll turn it back over to you, Josh.
Great, thanks, Mike. Thanks for that great overview of some of the exciting opportunities with microgravity and tissue engineering. So, I think that we can all see that there's a lot of opportunity with microgravity, and you'll hear a little bit more when we get into the rules of our vascular tissue challenge and then the CASIS Innovations in Space Award, and just how the researchers on this call might be able to take advantage of some of these future opportunities. So what we wanted to get into now is really the nuts and bolts of this challenge. So for all of the researchers that are on board with this this webinar, here's where we're going to talk about what do you have to do in order to win the vascular tissue challenge, and then what would you have to do with the CASIS Innovations in Space Award opportunity as well. So for this section, I'm going to first hand it over to another one of our judging committee members, Dr. Wendy Dean, who will kind of walk through some of the more specifics of the evaluation criteria in our rules. We'll go through what the actual criteria are that you're going to have to meet in order to win the award, and then we'll also go through the judging and review process so that you really understand, well, how does it work for the judges to actually get the information that they need to evaluate your work. What we're going through here is not a comprehensive set of the rules, so I do encourage you all to make sure you go onto our website, the neworgan.org website, and find the Vascular Tissue Challenge rules on there so that you can see the official rules online. But what we say here today is a summary of the evaluation criteria and the process that you'll have to go through. So with that, I'm going to hand it over to Dr. Wendy Dean to walk us through some more of the specifics of the Vascular Tissue Challenge. Wendy? See, Wendy, you might still be muted if you want to just make sure you're unmuted here. See if Wendy might have dropped off. Unfortunately, we're still not hearing you, Wendy. Okay, well, if we can't get Wendy back on with us here, what I'll do is I'll just run through these evaluation criteria, so that we can understand exactly what the judges will be looking for in any of the submissions and responses. So these are what you're looking at now are the evaluation criteria for submitting to this challenge. So, I think Armand had introduced a few of these before, but there's some more specifics in here. So, we're looking at survival as one of the criteria, that we want to see that 85% of the parenchymal cells remain alive, throughout your trial, and that they function within a 20% variance of what's considered native tissue function of the same type. So that'll be one criteria that the judges look for, is that your tissues are surviving throughout those 30 days, and that they're continuing to function related to the native function. As Armand mentioned, we're going to look at perfusion of the tissues, and the reason for this evaluation criteria is to make sure that it's not just getting the nutrients through diffusion of the tissue. It has to be thick enough that there's blood or channels flowing through the tissue, and that there is a perfusate. It doesn't have to be whole blood, but it can be any perfusate that's providing the nutrients to keep that tissue alive and functioning. I think Armand had mentioned when we were initially introducing the challenge that it does have to be at least a centimeter thick in any direction. So again, we're looking to make sure that it's not something that's just kept alive through diffusion of the nutrients. We are looking for cell types, volumes and functionality that are similar to native tissues. So I think in the official rules we mentioned that we're looking for 85% parenchymal cells within your tissue. We recognize that some tissues are naturally filled with lots of air pockets, for example, lung tissue. So we're really looking at just a percentage of the solid tissue type, to showcase that this is not a connective tissue like cartilage or something like that, but it's actually a functioning tissue, with parenchymal cells in it. We want this to be human cells. It can't be an animal model. And we want to have a success rate of 3 tissue samples. So we do have a limit in the rules that it has to be 3 out of 4 tissue samples. So if you have 1 failure, but you still have 3 successes, that's still looking fine. So that would be a success rate. And then one thing that we're adding into this is to make sure that every team will have a concept for a spaceflight experiment that might be able to move their research in this area forward. And that'll be something that CASIS uses in their evaluation of the Innovations in Spaceflight award that they'll talk about a little bit more down the line here. So those are some of the evaluation criteria. And then we wanted to mention what the actual process for the judging review is going to be. And there's kind of a 4-step process in this. That the first thing that a team would have to do is to submit a trial application. And this is where you will describe how you're going to go through the trial, what experiments and processes and materials you're going to need in order to do that, and to submit that to the judging committee. So that the reason for this is that they want to review what it is that you're doing to make sure you're going to provide them with enough information and enough data to accurately determine whether you've met the goals of this challenge. So once you do the trial application, then we're going to have a set of trial oversight procedures. And this is something that will be returned to you as a team by the judging committee. So after reviewing your application, the judging committee is going to give you some information on the oversight that they're going to need in order to make sure that they get the appropriate data to determine whether you met the criteria or not. So this will be a basic process which will involve at least one of the judges conducting an on-site visit at some point during your trial. And then making sure that you're gathering the information that they're going to need for their determination. The third piece of the review process is the final trial report. So this is something that you as a team would produce, based on all of your experiments, all the information that has been agreed upon in your trial application and oversight procedures, and compile that in a report that can be sent back to the judging committee. So this, along with the information that they've gotten from the trial oversight procedures, will be combined by the judging committee for their review of your trial and determination if you've met all of the evaluation criteria appropriately. So at the end of this, the judging committee will make the recommendation to NASA based on the information that they've received and reviewed on whether you've actually met the requirements to win this award. We also want to mention the registration process to get your team going. So there's a few steps that we're looking for a team to do this. The first thing and most basic is to submit an intent to participate or intent to compete form. And this is just informational. So it says who you are, what lab you're working with, and some basic information about what technique you're using to pursue winning this award. So that really is for our own information and to help us then promote you, showcase to NASA, who's working on this, really just to share some information. So I want to encourage everybody that's on this call who is potentially looking at being a team and winning this award to please find the intent to participate form on our website and submit that as soon as you can. Once you do the intent to participate, the next step is to sign the team agreement. And this form is also going to be given to you. This is the official agreement between you and the Methuselah Foundation, outlining the specifics of how you, us, NASA all work the delivery of the award money, the requirements of judging of appeals, things like that. So that team agreement is really important to be officially allowed to win the award. So before you start your trial application or before you're really getting into doing a trial, you're going to make sure that that team agreement is signed and submitted back to the Methuselah Foundation. Once we have that team agreement, then you get into the trial application, as we mentioned on the previous slide, where we're actually working with the judging committee to review and approve your procedures and the data that you're going to be gathering for the judging committee. And the last thing is that there is a team registration fee, and this is only to offset the cost of actually having the judging committee go to the lab and review your trial. This fee is not due until you're ready to launch your trial. So you can begin the intent to compete. You can get your team agreement in. You can start working on the trial application fee or the trial application before you have to bother with any registration fee. So the registration fee again is only due when you're actually ready to get into the trial and you've been approved by the judging committee to do so. So that summarizes the vascular tissue challenge evaluation criteria, the judging procedure, and the registration process. What we also want to give you guys a little information on is the CASIS Innovations in Space Award, which is a separate award from CASIS for one of the winning teams. For this, I'm going to turn it over to Jana Studemeyer from CASIS, who will tell you more information about this award. Jana? Or is that Mike that's going to do it?
Can you hear me?
Yeah,
yes,
Mike,
Josh,
is that you?
Mike,
yeah. Sorry.
No problem.
Go ahead. We can hear you now, Mike.
Very good. So just to elaborate upon what Josh said, the CASIS Innovations in Space Award is separate from the Centennial Challenges Program Award. It's not contingent that you develop a flight experiment or that you demonstrate the ability to vascularize tissue in the microgravity environment, but there are, we believe, certain advantages to going down that path and utilizing the unique environment of microgravity to pursue those challenges. So CASIS is offering $200,000 in support for hardware development or implementation, what we call implementation partner costs. So these are costs to develop a flight experiment based on the demonstrated ability of one of the teams to vascularize thick tissue. So what this offers you is not only additional funding support to actually demonstrate the technology in the microgravity environment, it also provides you access to the International Space Station National Lab. So all of the costs associated with the launch of the experiment to the International Space Station, the return of samples and or data from the International Space Station, and the actual operation of the experiment on board the International Space Station, those are all covered. So the average cost of conducting a research experiment on board the International Space Station is on the order of $7 million. So this is, we believe, a significant opportunity for a research team to not only realize the potential of their vascularization technology, but actually to demonstrate its application in a relevant environment in microgravity. any questions that you have about previous research in microgravity that may have impact upon your technology development or your research, you are certainly welcome to connect with CASIS directly, or through Josh Newbert and Jana Studemeyer. We can point you to the relevant literature that's available through CASIS or on the NASA websites. Thanks, Josh.
Great, thank you, Mike. So yeah, we want to encourage everybody to consider this challenge. Please do ask us any questions. If you have questions online now, we're happy to try to address them. You can also contact me. I'll share my information in a minute. If there's any thought on or questions on how you approach this challenge or the benefits of this challenge, please do bring them up to me. One of the main benefits of doing this as a prize program is that we get to help you guys and putting your information out there. We're going to try to find other connections. That this is a real community that we're trying to build with the New Organ Alliance and our partners of CASIS and NASA and others that we're working with. So we put these prizes out there not only as incentives to try to advance the research that you guys are doing, but also as a way to draw more public attention to the work that you're bringing in, to the advancements that you're creating, and to really bring more support to what it is that you guys are doing. So in order to do that, we really need you to just submit that intent to participate form. And then that lets us know a little bit about what you're doing, see how we can help bring the community together to help you advance your research. And I want to stress that, we want this award to be won. This is not something where we're going to try to put up as many roadblocks as we can just to keep it going. Now, we want this to be won. So if you're out there and you see something in the rules that is just absolutely going to block you from doing it, or you have a question if you can maybe use a different type of tissue or do something a little bit differently, so long as it doesn't violate the procedures and processes put into the rules, we're going to try to work with you on it. We want the technology of this advancement to be realized, and we don't want to put up unnecessary roadblocks that detract from that technology. So I just want to mention that to everybody that might be considering this this award, that please look at us as a resource for you to try to move your research and activities forward. So you can find the intent to participate form online. You have the link up on this slide there. So I hope that we'll have a number of you be able to submit those to us shortly. We also have a workshop coming up. I mentioned at the beginning of this presentation that the New Organ Alliance has been starting a road mapping program where we're trying to understand from where the research is now, what are the pathways and the milestones along those pathways to actually get to the end goal of having those tissues and organs in the hands of the patients that need them. So this was started in 2015, the summer of 2015. We did a road mapping workshop in DC and had a roundtable at the White House with the Office of Science and Technology Policy about this. And now we have a second workshop that is specifically geared towards this vascular tissue challenge, where we're going to look at all the research that the teams are doing, seeing what the state of the art in creating thick tissues, thick vascularized tissues is, and then try to roadmap those pathways and milestones and the challenges that will come up on the way towards getting to that end goal. So we certainly hope that everybody on this call can join us for that workshop. We'll be sharing more specific information about it, but you can see it's going to be on November 9th. And there are some limited travel grants, for teams that actually have their intent to participate forms in. So if you are a team, please try to get those forms in as soon as possible, and then you can be considered for one of the travel grants that we have available. Those are provided by the National Science Foundation that's supporting this upcoming workshop. So with that, I believe we've covered all of the information that we have, for this webinar. We want to open it up again for any questions. If anyone in the audience has questions, your mic is probably going to be muted, so please make sure that you type them into that chat box in your control panel, and we can address those questions in the next few minutes. So, if anyone has questions about any of the information we've shared about the partnerships that we have involved in this, or about any of the evaluation criteria for the vascularized tissue challenge, or the CASIS Innovations in Space award that's available, please go ahead and let us know. And if we don't have any questions immediately from our audience, we'll go ahead and close this webinar for everybody. You can find my contact information on the screen. Again, I'm the managing partner for the New Organ Alliance, and I'll be happy to answer any questions over email or phone calls as we get into looking at what you're doing with the research and potentially participating in this vascularized tissue challenge. Great. Wonderful. Thank you all for participating in this webinar. Thank you for taking the time out today. We look forward to keeping in touch with you and talking with you as we move the challenge forward. Have a great day.